Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Nigeria Labour Congress in Edo State proceeds with protests amid coronavirus pandemic, rejects National NLC's position on suspension of action. Bauchi government to mass-produce hand sanitizing machine produced by Indigenous firm. And COVID-19 cases in the United States rises above 7.1 million. As countries continue to open up their economy and some others modify their lockdown ease following newer cases, the world has registered over 33 million coronavirus cases. According to Johns Hopkins University Coronavirus Resource Center, the number of deaths is closing in to 1 million, with the US, Brazil, India, Mexico, and the United Kingdom the top 5. Over the weekend, the WHO warned that the global coronavirus death toll could hit 2 million before any effective vaccine is widely used. Meanwhile, recoveries around the world is nearing 23 million. In Africa, data from the Africa Centers for Disease Control and Prevention shows that more than 35,000 people have died from COVID-19 complications since the first case was confirmed in Egypt. The death toll includes the likes of Somalia's former Prime Minister, New Hassan Hussein, Nigeria's President's Chief of Staff, former President of the Republic of Congo, dozens of health officials, among others. Africa's populous nation, Nigeria, today has seen more schools resume across the country amid the pandemic, with state governments calling for caution and adherence to the COVID-19 school reopening safety guidelines. Last night, the NCDC announced 126 new confirmed cases and 2 deaths in the country. The new cases are reported from 12 states, the FCT recording the highest at 30 cases, followed by Lagos 24. Rivers recorded 23 cases, 13 were recorded in Ogun, 9 in Katsina, another 9 in Plateau State, 6 were recorded in Ondo, 4 in Kaduna, 4 in Kwara, 2 in Imo, 1 each in Bauchi and Edo State. In Kaduna State, the 4 samples that returned positive were out of 43 samples analyzed, and the new cases are 1 each from Chukun and Sabongeri and 2 from Kaduna South. Till date, these are our latest figures: 58,324 cases confirmed, while cases that have been discharged stands at 49,794, and we have lost 1,108 persons to COVID-19 across the 36 states and the Federal Capital Territory. Now, Labour leaders and members of the civil society in Edo State, South Nigeria, have criticised the decision of the national leadership of organised labour to suspend its planned nationwide strike at the last minute without consulting members and key stakeholders across the country. The Edo State chairman of the Nigeria Labour Congress, Mr. Sonny Osayande, and his trade union Congress counterpart, Marshal Ohu, speaking at the King Square Arena in Benin City, the state capital, where a protest march was initially built to take off, said the recent actions of the national labour leadership are weakening the labour movement in Nigeria. And this is coming as the country battles the coronavirus pandemic. The NLC is threatening to go on strike on some of the issues like increase in electricity tariff, high cost of living, among others, in light of the effects of the pandemic.
No electricity in Edo, for information. There's no electricity in Edo where it's at the outpeak. Many people have parked their cars, so I can no longer go with their vehicle. We join taxis here and there. So the struggle, like the rally said, they have suspended the strike for only 2 weeks. But I think they have made a grievous mistake. They would have come back to NEC to decide the next act of action. They hurriedly went into negotiation to call off the strike. I think Edo people are not too happy. We are not happy. Leadership, are we happy?
No!
Leadership, are we happy?
No! This was not what the founding fathers of Labour bargained for. That Labour had degenerated to this extent, and I really did not know how we degenerated to this extent. We were supposed to be the voice of the common man in the street. We were supposed to be a voice to reckon with. We are supposed to be a voice government will reckon with. As I speak with you today, Igige has continued to make fool of us. because we've not been able to hold our onions. As I speak with you, there's no equal and opposite reaction to what the government is doing. I bet you, in every situation, if there's no equal and opposite reaction, things will always go like this. We cannot continue to suffer this way just for 30,000 naira.
The major issue is privatization. When they privatized electricity supply, that's when our problems started. Making us to pay for darkness, we say no to that. Secondly, our refineries must work. So all these palliatives they are talking about have not addressed these two fundamental issues.
Burdened by the negative impact of the coronavirus pandemic on the finances and administration of local government councils in Nigeria, the chairman of Kaduna South Local Government Area, Mr. Kabir Jarimi, has appealed to the federal government to provide special grants to the third tiers of government to enable them respond adequately to the pandemic. In an interview during a town hall meeting on the budget of the council, Mr. Jarimi notes that states and local governments are on the front line of the COVID-19 crisis, a situation which he says means increased spending on public health despite the low allocation they receive from the federal and state government.
The local government in Kaduna State, some of us are solid while some are liquid. From Kaduna State local government, we have a paucity of funds, which is one of the challenges might see. But with the help of the state government, we have come over all those challenges. If we have a case of suspected case, most of the local government don't know where to start from where to pick the patient to the isolation centers. But for us in Kaduna State, I think we don't have much problem because the state government has been responding to our request. But from the federal government, we also want the federal government to be responding to the cry of the people and from we, the council chairman, because most of the time, before we even cry, is from the people. So the only request we have from the federal government is to come to the aid of the state government and the local government.
Young people from the National Center for Petroleum Research and Development at Abubakar Tafawa Balewa University, Bauchi State, have invented an automatic hand sanitizing machine which performs multiple functions. The locally made sensor machine accommodates soap, water, dryer, dustbin, a voice message, and it's able to read body temperature. The team presented the invention to the Bauchi State Governor, where he has directed them to produce in large quantities for onward distribution to schools.
The machine here is an automatic hand sanitizing machine that uses a sensor, as you can see, a hand. It will detect your hand, dispense a soap, because the washing of hand is a routine. It starts with dispensing the soap, subsequently washing the hand, then it will now dry your hand. So in this machine, as you can see, we have incorporated hand detecting sensor that will detect your hand, dispense the soap, read your body temperature, as well as dispensing the water automatically without making any contact. And then after you finish the hand washing routine, you have the tissue by the side, which you rinse your hand and then dispose in our waste bin.
We are very proud of you that in Bauchi, an indigenous group will come out and produce something like this to confront the global challenge of COVID-19 and deepened the NDC guidelines or protocol of social distancing and washing of hands and all the sanitation that is required to keep us safe and secure. You have really imbibed in this invention and this innovation. You have provided an engineering solution, and it is very cost effective at the cost of 150,000 naira. Definitely, I will direct the Deputy Governor, who is the chairman of the COVID-19, to discuss with you with a view to producing this machine massively for use in our schools.
So apart from heightened ICT, we're also seeing a massive innovation amid the coronavirus pandemic. Let's talk some more about flattening the curve. Joining us in our Lagos studio is Dr. Oluwatosin Akinshola. He's a lecturer, epidemiology and biostatistics, College of Medicine, University of Lagos. Thank you for joining us on the program.
Thank you, special.
All right, let's look at the trends over the weekend. And what do you think? Some of the cases reduced, fluctuating pretty much. We haven't seen as much as we saw in August, over 300 cases. Are we close to flattening the curve? Are we there yet? Or have we passed it?
Well, if you go by the statistics we are having, many people reach that conclusion that we're actually flattening. But in real sense, I don't think we are flattening a curve because of the fact that presently we are having under-testing capacity. We are not testing enough. And if you are not testing enough, there is no way we can develop new positive cases. And that is the problem we're actually having. For example, if you compare what is happening in Nigeria to other countries like India, India are having an average of over 1 million number of cases. As they're opening their space, they're also testing. So it is in that situation you can actually have the true picture of what the present situation are. So, but if actually we are not testing, so there's no way we can ever even know people who actually have it. So that's actually the problem.
We have some of states like Borno State. In the last 26 days, it hasn't reported a case. Kebbi recorded last in 29 days ago. Zamfara 37, and Kogi has seen 85 days without any case. And this is compared to other states, perhaps like Lagos, Plateau, and maybe Kano, where they seem to have larger testing capacity. What do you think is happening in those other states?
Well, if you look at these states we mentioned, we can actually classify them into two groups. Like the first, the northern states. Presently, we know what is actually happening there. Insurgency has been the order of the day. We are having banditry. And in this kind of situation, you cannot have severe like testing people. Most of the state government, they are concerning how they are going to arrest the insecurity. So the issue of COVID, though, is still much on the front burner, but the insecurity actually covered the matter up. Unlike Lagos, that we have relatively peace, there is so much kind of terms of security. That's where you can monitor people and actually have some testing. So those states you are talking about that are having fewer cases like Borno, like Zamfara, I think the insecurity challenges there can be attributed to why they're actually having a very few number of cases.
So with our lower testing positivity ratio and with a lot more of our economy opening up, schools also this period, what do you think the federal government and perhaps the state governments who have that responsibility need to put all their focus on to make sure that the curve is flattened in their various states?
Yes, unfortunately we find ourselves in a dilemma now that we cannot continue to lock ourselves up due to this COVID-19. And now schools have resumed. Everybody are now going to their normal routine. And there is a common saying that we're having a new normal now. And in that situation, the only thing is that the government at the federal level, they need to actually have, maybe after that, the NCDC, so we actually have what we call a real-time data. When we have a real-time data, we need to have the situation analysis of what is the situation of things we're actually having presently. But the data that LCT has been portraying is not a true reflection of what's actually happening. And concerning the state government, I think we need to appeal to most of our state government that they also need to deploy funds so that they can actually be able to engage in testing their people. Because if you don't test people, there is no way for us to be able to have the number of people who actually have, in this case, all those who are carriers. So that's the challenges we're actually having with the state government.
All right, we appreciate your time. Thank you so much, Dr. Oluwatosin Akinshola, lecturer, epidemiology, biostatistics, College of Medicine, UNILAG. Thank you for joining us on the program.
It's my pleasure. Thank you very much.
We have more on the global response to the pandemic when we return. Please stay with us. Secondary school pupils have been resuming in phases in Ekiti State, with teachers, students adjusting to the new normal. As observed across the state, students are required to attend classes with their face masks and to have the prescribed temperature checks and, of course, wash their hands. Some teachers and heads of school say they have been hands-on to enforce the protocols, and they believe the pandemic has further heightened the use of ICT.
We have tried close to 90%, let's say 90%, to make sure that they distance themselves, and we make sure on timetable they wash their hands minimum of 4 times in a day while they are in the school compound, and we sanitize them. And we make sure all of them use face mask.
We pray that this COVID-19 should be over soon, because we do not used to be as we are in the class before. Before we used to play with each other, we used to stay free in class, but now we go to class with our nose covers and we sit far away from each other.
Let's talk some more about COVID-19. Professor Titus Ibekwe, he's an ENT specialist. He joins us from our Abuja studios. Glad you could join us on the program. Welcome.
Thank you for having me, Melissa.
All right. My previous guest today said that real-time data was perhaps a problem. Would you say that that is also hampering the fight with regards to the numbers we're recording and the true response to the pandemic in Nigeria?
Yes. You know, there's this dictum that is when you seek that you find. If we take a look at our testing rate, I don't think it has taken us to desired level. And it will also be very difficult to make a very concrete scientific conclusion based on that. Truly, if we look at the cases as being spread on the surface, then it appears as if we have reached the peak and there's a decline. But if you look very deeply scientifically into the number of cases being tested over the period of time, and comparatively, you also look at the analysis of the monthly analysis data that is released by NCDC. We recall that in August, it was released that there's 36% decline in the testing rate and about 25% decline in the rate of positivity. So if you juxtapose this and put it together, you'll realize that it doesn't really truly reflect that we are having a decline in the number of cases, or that truly that we have a decline in curve. But what is there is that we should be encouraged to step up our testing capacity, and most importantly is the non-pharmaceutical precautionary measures to ensure that we don't over-relax, as is being seen presently, that everybody is still up to the game. And when we adapt these precautionary measures, that's what will help us, to see this disease to an end. Otherwise, the way we are going, it may not just be the true reflection of what the data is. And it's a new normal, so we must learn how to live with it. Life must continue. As rightly said, the lockdown must not be in perpetuity. But what is very important is to ensure that we deepen these precautionary measures. We deepen the guidelines that has been outlined by NCDC in our various institutions and facets of life, including schools. Once all these are observed and we intensify truly our enlightenment program, because it appears most of the citizenry are relaxing on their guard now, so that we'll be able to bid farewell to this disease, because usually, as we know, the second wave is normally more deadly than even the first wave.
Do you fear that we might be facing that? Professor Ibekwe, yes. With what is happening in some of these places you've mentioned, do you fear that we might come to that point where a second wave is inevitable?
Well, it is not our wish, but a very intelligent person learn from other people's mistake. You don't allow yourself to go through the same pathway, So it is a call that we should do everything possible now that it appears as if we are getting off this disease, that this is the time to step up our games. It's not really the time to relax, so that we don't get to that stage of having, a second wave. If you take a look, you see that these countries now are using everything within their disposal to fight, including technology. Some are using apps in United Kingdom, even natural mechanism. In Finland, they are using sniffer dogs, well trained to detect people who are positive for coronavirus disease. But here we can say that we have certain inherent factors that appear to be protecting us, which is not really very clear to the scientific world, because most of the cases we have, truly and sincerely speaking, are mild and moderate cases rather than very severe cases. Look into the crystal ball, you ask yourself, does that have to do with the spread of our population? Because here mainly we have young population. At least 60% of Nigerian population are below 60, and compared to the developed countries where reverse is the case. You also ask yourself, does it have to do with cross-immunity of a sort? Does it have to do with the BCG vaccination that is part of our routine immunization, which has been proven to have some level of protection, which we know that is still routine within the country? Or does it have to do with, our ways of going about things? Because Nigerians have passed through certain very difficult diseases in the past, including Ebola and co. So is there cross-immunity of a sort? Nobody is very sure of any of these factors, but all that we know is that the disease is still real, and that one active disease is as bad as having many. And we should fight as we fought against wild polio and ensure that there is zero case of coronavirus disease in Nigeria. It is then and only then that we can beat our chest and say that we have defeated the illness. But as it is, with the pictures that we're seeing, it is not yet Uhuru.
Over. Thank you so much. We appreciate your time on the program. Professor Titus Ibiekwe, ENT specialist, thank you for joining us.
Thank you for having me.
Now, the U.S. on Sunday recorded 36,919 new coronavirus infections and 266 virus-related deaths the same day, bringing the total number of the cases above 7.1 million, and the death toll also above 200,000. Let's get more on this and other stories on the global COVID-19 update.
According to Johns Hopkins University, the U.S. case count has risen above 7.1 million, with the national death toll reaching 204,743, the highest tally in both categories worldwide. Florida has become the third state in the U.S. with over 700,000 coronavirus cases after California and Texas. In Brazil, the largest city in the country's Amazon has closed bars and river beaches to contain a fresh surge of the coronavirus cases, a trend that may dash theories that Manaus was one of the world's first places to reach collective or herd immunity. Authorities say residents are ignoring the virus and may face a second wave of contagion by not wearing masks, packing into bars and attending parties. In China, the health authorities reported 21 new confirmed cases of COVID-19 across the mainland on Sunday, all of which were imported. A total of 12 COVID-19 patients were also discharged from hospital after recovery. And the New Zealand authorities say travel between the country and some states of Australia is possible before the end of the year. Plans for a travel bubble between Australia and New Zealand has been in discussions for months as both nations slowed the spread of the coronavirus. But these plans were disrupted after a resurgence of COVID-19 in Melbourne, Australia, followed by a second wave of infections in Auckland.
It is possible. Again, what we'd need to be assured of is that when Australia is saying, OK, we've got a hot spot over here, that the border around that hotspot means that people aren't able to travel into the states where we are engaging with in trans-Tasman travel. So just getting a bit of an understanding of how that's likely to work. Again, we've got a strategy of course, having a COVID-free country, and so that's our ongoing goal and way of operating.
New Zealand has only 59 active cases and 1,477 confirmed cases of COVID-19 so far, one of the lowest tallies in the world.
You can take a look at more updates on the pandemic on our website. That's channelstv.com. You can see there the global COVID-19 death toll to have surpassed 1 million. That's coming from Worldometer and also the AFP. Many other stories on our website, channelstv.com. Thank you for watching COVID-19 Update Program. I'm Millicent Nwaka. Stay safe.